a disease which infects people from all walks of life. Tuberculosis or TB is an infection caused by bacteria called Mycobacterium tuberculosis. This bacteria mainly targets the lungs, causing pulmonary TB. Also, it could cause extrapulmonary TB by infecting organs like lymph nodes, brain, bones, and kidneys. In this video, we are going to talk about pulmonary TB. Globally, TB is a leading cause of death from infectious diseases. It's more common in lower-income countries, but it affects people worldwide. TB is particularly prevalent in crowded and impoverished settings where healthcare access might be limited. However, it can affect anyone. When a person with active TB coughs or sneezes, tiny droplets filled with TB bacteria are released into the air. Others can inhale these bacteria when they breathe the air where the droplets have landed. Once inside the lungs, the bacteria can start to multiply and cause an infection. Depending on the involved organs, there could be different symptoms. Let's look at the common ones. One of the most common symptoms of TB is a persistent cough that lasts for more than 3 weeks. It may be accompanied by chest pain. People with TB often experience fever, which can be mild or high. This fever is usually persistent and may come with chills. Unexplained weight loss is another symptom. If you are losing weight without trying, it could be a sign of TB. Night sweats are also common. You might find yourself sweating excessively during the night, even when the room is cool. And finally, fatigue and tiredness are frequent in TB. You might feel usually weak or exhausted even with plenty of rest. First, let's talk about how TB is treated. TB treatment usually involves a course of antibiotics. The most common treatment is a combination of drugs taken over several months. The treatment typically lasts for 6 months. It's important to complete the full course even if you start feeling better. Regular checkups with your healthcare provider are essential during treatment. They will monitor your progress and adjust the treatment if needed. Adherence to medication is crucial to prevent complications. Now, let's discuss how to prevent TB. Use tissues or your elbow to cover your mouth when coughing or sneezing. Wash your hands regularly and wear a mask to stop bacteria from spreading. Regular TB screening, especially if you're at high risk, can help detect TB early. If you're in contact with someone who has TB, getting tested is a good precaution. In some countries, the BCG vaccine is given to help prevent TB. It's particularly useful for children and those in high-risk areas. Preventing TB is a community effort. By practicing good hygiene, getting tested, and following health guidelines, we can work together to reduce the spread of TB.